when the world has got you down. And
Alzheimer's sucks. It's an equal opportunity disease that chips away at everything we hold dear. And to date, there's no cure. So until there is, we continue to fight with the most powerful tool in our arsenal, love. This is Love Conquers Alz, a real and really positive podcast that takes a deep dive into everything Alzheimer's, the good, the bad, and everything in between. And now, here are your hosts, Susie Singer-Carter and me, Don Priess.
Hi, everybody. I'm Susie Singer-Carter.
And I'm Don Priess, and this is Love Conquers Alz. Hello, Susan.
Donald, how do you
Yes. How do I do? I do okay. You know, how do you do? How do you do?
do? Wow.
Yeah.
I'm fine. Yeah, I finished. Here's my big. I'm gonna make my announcement. I finished the ROAR for long-term care. ROAR, the number 4 LTC website myself.
.org.
Yes, because nonprofit is just another word for sweat equity. Is what I'm saying. Yeah, but I feel very proud of myself.
Yeah, she did. She did the entire website from scratch by herself. It looks great, and it's all functional and everything. And she only spent about 18 hours a day for like 7 straight days doing it.
I did.
You know, yeah.
I did. I'm a maniac. I could not. I was like, just one more. Let me just get this done. And then it's like 4 a.m. And then, yeah. And that's when mistakes start happening too. So, yeah. But yeah, so I invite everybody that's listening to go to our roar for ltc.org and you know, at least take a look at it and see what's there in terms of our mission to reform long-term care. Based on our documentary, No Country for Old People, which is a very important project, we think, for everyone to see, because it's a real snapshot of what our long-term care system truly is right now, which is not great, and it needs to be reformed like yesterday. And that's what we hope to do with ROAR, which stands for Respect, Oversight, Advocacy, and Reform. And we need as many people to join and be a part of it, be a roarier, and roar for people that don't have a voice. And there's way too many. So we could use your help in any way that you can help. We invite you. So, and even if you don't, take a look at the website, share it with somebody else, or if you have feedback and you want to tell me something, don't. About
She doesn't want to hear it. But we are looking for volunteers. We're looking for donations. We need
donations.
That definitely.
I always forget the money part.
Yeah, I know. But we don't like to talk about that. But it's a reality, and we need it to move this engine forward. But volunteers are just, if not more important, to do whatever. Bring your skills to the table. We need people's stories. We need people to share with their story, because all the whole thing, starting with No Country for Old People and the ROAR movement, it is storytelling. It's hearing people. It's knowing what's going on.
It's the power of story. Because story really does resonate with people more than data does. So that's a good point. Excuse me, Dawn, because we have a page where you can share your story. You can upload it. You can upload video and photos, images, and your document, or however you want to share your story. And if you can also read other people's stories there that are there for you to read. And that really can be very comforting, and let you know that you're not alone. And certainly you're going to find stories, maybe most of them, that you're going to relate to and say, I went through that. I get it. I've been there. And you will feel vindicated and hopefully motivated to want to help change this system, because it's just it's just it's the status quo for 50 years. So we really need to accelerate the reform, because people are suffering
every minute of every day as we speak.
As we speak.
Yes.
Yes. So, and what's up? Anything good other than that? Is anything good that you want to share?
Well, by the time this comes out, we'll see. I'm sure it'll be after the Super Bowl. My Rams won yesterday, so I'm very, very happy. They still have, they're not in the Super Bowl yet. They still have another game, and hopefully that will happen. So that put me in a good mood. And I think that's important because who wants me in a bad mood? Nobody does. Nobody
does.
You spent a fabulous day with your family yesterday, and you're still paying the price.
I'm still paying the price. So I have 2 little granddaughters, 3 and 6 now.
6.
She's 6,
yeah.
and now because that wasn't enough, then my daughter had to get a brand new standard poodle named Penny Lane, who is absolutely gorgeous. But Penny Lane does not know how big she is. Penny Lane has giant paws and literally doesn't sit on her. She sits on her butt like a human being. Like her legs are there. They're like long legs. She crosses them. She really thinks she's a human being and does no idea how big she is. She's like 16 weeks or something, 17 weeks, and she's close to 20 pounds, and she's huge.
Yeah.
She's got paws like this, like boom, 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 like she could play pickleball with her paws. So
And she does.
So
I saw her doing that yesterday. Yeah.
She does.
It's amazing.
They're smart poodles. Poodles are smart.
And she outweighs the other 3 dogs.
Yeah,
almost outweighs them combined.
Yeah.
the two Yorkies and the Yorkie
my
poo,
little Yorkie that's 5 pounds.
Yeah, but they bark at this dog all day long. They do not stop. And
it was hell yesterday, but good hell,
Good hell.
Good hell. Yeah,
Yes.
fun hell. It's all good. I'm not complaining.
Yes.
I'm just sharing. I'm just sharesies. So feel free to sharesies back. But, that was a lot of energy. I'm just saying. It's a lot of energy with
so
puppies
if Susie
and babies.
falls asleep during the interview,
Yeah.
it do not take, it's fine. I'll pick it up.
I
I'll
have
wake
my
her.
caffeine
but,
drip. I've got my caffeine drip. I'm good to go because we have a great guest today.
We really do. She's super interesting and has some great stuff that she's doing.
Before you get into our guest, I just want to say that it's the beginning of the year. I'm not going to say Happy New Year because it would be like people get angry because it's past the whatever. But Happy New Year, haha! I did it. But we've been really busy with the documentary, as you know, and we used to do 2 shows a month. And I think, now that things are getting a little bit more back to normal, I hope that we get back to doing 2 shows a month. And then, whoever is still listening to us and watching us, thank you for sticking with us. We have the best guests. I'm just saying, not, I don't know. We just do. And I'm so proud of all of our guests. So, and we've got a bunch of really fantastic people booked, and we're going to be, obviously you can tell we've expanded our conversation from not just Alzheimer's, but also long-term care in general. So stick with us, share with other people, remind them that we're here because I really feel like it's, we're going to have some good stuff for you. Okay, that's it. So let's go on. We got a lot of things to talk about.
Definitely. One of them is our guest.
Yeah.
Should I introduce her?
Don.
Should I do it? Okay, I'll do that right now. Lindsay Friedman is a care advocate, writer, and educator dedicated to transforming how families navigate aging, caregiving, and long-term care. Lindsay brings a rare perspective shaped by her real experience on multiple sides of the system, from working as a nursing assistant in memory care, nursing homes, and assisted living, to serving as a family caregiver, and she was a care recipient herself. She's the creator of CareBloom and LTCareNav.com, 2 powerful platforms designed to make long-term care more proactive, compassionate, and clear, helping families identify risks earlier, plan smarter, and avoid crisis-driven decisions. If you've ever felt overwhelmed by the long-term care journey, stay tuned and say hello to Lindsay Friedman. Hello, Lindsay.
Hello. Thank you so much for having me.
Hi, Lindsay.
Hi,
Thank
Susie.
you for coming on. Yeah, I'm so happy that we connected over the holiday and that we got to get you on so quickly, because I like you do so much in the long-term care community and arena, and like in so many different ways. So super excited to talk to you about what you're doing, especially with the AI. And so why don't let's just set the stage of what you do with your professionally, and then go back to why and how you got here.
Okay. So I'll kind of break it down to one company and then the other. So the first one is called CareBloom, and we are a caregiver support tool that allows families to have peace of mind under their caregiving journey. So what's really nice is it's a watch. We kind of track behaviors. We track ADL, so it's not about health as much. It's really, did mom get out of bed? Did she eat her breakfast? Did she use the bathroom? Is she moving around? Is she staying where she's supposed to? We alert on all these different things that is set by the user. But, as Susie and I spoke, what's really different about what we're doing is we also offer a piece for the home health aides or for the nursing assistants where we can track their behaviors as well. This company came about because of my experience with my grandma and having been a nursing assistant, to see how there's a lot of shortcuts in the industry on the behalf of the aides. A lot of it is, the majority of it is because they are understaffed and taking care of too many people, and the only way to get it done is to rush. And when we rush and these situations arise, quality of care diminishes drastically. So what we do is we actually verify that the tasks are being done and done completely and not rushed, because better care means better outcomes. Mm-hmm. So that is one, that's CareBloom. And then LT CareNav came out of the questions I was getting from CareBloom. So we were doing installs into homes and people were like, this is great, this is going to be super helpful, but how do I know when my mom needs more care and we have to look at a facility? What is that facility going to cost where I live? How am I going to pay for it? And who do I contact when the time is right? So as much as CareBloom was giving them this great solution, there were still so many open questions. And so I created CareNav to address those exact things. So when you come to our site, which is free for every families to use, because I thought that was so important, we take some information and we actually give you all that. We understand what your care trajectory looks like to give you a really comprehensive idea of what care might look like today, tomorrow, 5 years, 10 years from now. How are you going to pay for it with the financial means you have today versus are there tools that you could use to help? What kind of public assistance are there? Or how to come kind of to a really nice, safe landing into Medicaid, because the earlier you plan, the better your situation's going to be. And then lastly, we actually set you up with a care concierge team. We are not a place for mom. We are not mass lead generation. We are Care Connection. So we have vetted every single person who is on our site, and we make a match for you that says, here is Jane. She's a great person to know, and when you're ready, reach out to Jane for these sorts of needs. And we give you a bunch of suggestions along the way, and it's up to you to understand how you want that connection to occur. But it's a whole toolbox for long-term care.
It's excellent, because we talk about aging in place and how much better it is all the way around, for someone who is on a disease, who has a disease that's exponential, right? So, but they're going to do better at home. But there is a time, so often, sadly, that it gets to a point where, whatever your situation is, you may not be able to take care of, you can't keep up with the comorbidities. And then, or you may not have the space, you may not have the funds, so you have to think about that in advance. It's better to think about it in advance than when you're scrambling because you've run out of money, or there's been a 180 in your loved one's health, and you can't keep up with it. So that's so important. That's so important. I just want to say before, like, is this service have a price tag to it?
CareBloom does have a price tag. It's hardware. There's a cost to it. We have tried to make it as easy of a decision for families as possible. So we actually don't charge for the hardware. And so it's just a monthly fee. We really feel that families need this and they need support. So our goal is to not gouge by any means. So there is no upfront hardware fee. You use the
Right.
product. If you like it, you just pay the monthly fee.
It's like cable.
It's like cable, right? And it's less
Yeah.
than cable.
But
Yeah,
does that when you're at a facility though? How does that have? Do you have to work with the facility to A, get permission to use it? B, does it incorporate with any of their systems, or how does that work?
So as a family member, if you are in a facility, you have the right to use it. I don't know, nationwide there might be some stuff, but here in Ohio, we had a law passed that we can have devices for families to monitor. So I think that is a huge game changer. I think that should be, you should be able to do that across the country, right? I think it's going to change the landscape. What's really nice is that we're not cameras, so there's still some privacy for the families. So we, in Ohio, you can go in and you can put it in and you're good to go. We are starting to work with facilities and to get that so it's more of a wider range practice that they have. We are working, it's been an interesting push to understand the value of monitoring caregivers. And Susie and I had this conversation. They almost don't want to know that they're doing a bad job or that they're not providing care, and they don't want to be held accountable, and this holds them to accountable. So we have had pushback with that piece of it in assisted living, which is really sad because your approach should be, I see the care is not being done. What can we do? How do we readjust, right? It's not about punishment. It's readjusting behaviors to meet expectations, right?
Yeah, but that plays into the business model.
Yeah.
It plays into the business model because it's unfortunately the frontline providers, our frontline providers are answering to other chiefs. So they're answering to the corporate. The corporate doesn't really care. They just want to be, they do their minimum of function to make the most amount of profit. And that's just the way it is right now. So holding them accountable, you have to hold them accountable because no one else is. However, it's difficult because it puts them in a position of they're between a rock and a hard place because they have to answer to you.
Yeah.
And then
to
they
corporate.
have to answer to their corporate. So that puts them in but you know what? Don't let that stop you because despite that, you have to know as a caregiver what is going on with your family, with your loved one. You have to, because there is the right amount of oversight and enforcement and accountability. So you must be all those for your loved one. And, that is just the nature of the beast right now. What kinds of things does it oversee that this technology oversees? Like if someone is mobile, does it report on turns and hydration and changing of diapers and all those things? Yes.
Yep.
And feeding and all that, yeah.
Yeah. So actually, our first test with this was before COVID.
Wow.
We went into nursing home before COVID to really test toileting and turning because those are the two, I think, tasks that are done that really determine how healthy you're going to stay, right? Toileting, not changing, ulcer, like you get bed sores, you get UTIs, and then turning really comes down to those pressure ulcers again. So those are the two big things we were really tracking. And we went into a home that our investor was great and got us into, had a relationship with, and the owner of the home was like, "This is going to look real bad." And it really, matter of fact, he's like, it was a Medicaid home. And he's like, but let's see what we can do. He's like, I want to see this. So we put it on 100 patients. 3 in particular who had bed sores, like you've seen, Susie, that just terrible. And we didn't tell the caregivers what we were monitoring. And the owner was like, "You're wearing this." So we had a few months and we watched their behavior and then we took their charting. And they were marking that they were toileting, turning 100% of the time. Like, check, 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 right?
Yep.
Less than 20% of the time were we able to verify the task.
Yeah.
So
That's so important, everybody. You need to listen to that's a really important thing. Less than 20% of the time.
Because you'll see those charts sometimes sitting behind them, and it'll say, 2 o'clock, 4 o'clock. And you're like, are they really doing it, or are they just putting that, or are they just writing it in? And,
Right.
you know,
Or
and
even
in
the
mo-
opposite.
yeah.
Like when I would go into, and I put this in the documentary, like there was a chart, a turning chart, and like there was nothing filled in from like 7 a.m. to like 4 p.m. when I got there. And in my mind, I thought, oh, they're just so busy they didn't fill it in. But in fact, no, they just didn't get to her.
Yeah.
And I'm surprised they left those checks blank. I remember seeing that on the documentary, and I was like, well, they're more honest caregivers, because most times, and when I was a nursing assistant, I watched people do check marks, and I was like, let's chat about this, right?
Yeah.
So, but we went back
But
in.
it doesn't also show, I'm sorry, Linda, I'm just going to say,
go
but
ahead.
that
No,
just
go.
shows how busy they were, because they didn't even have time to go back and
And
Fucks
fake
it.
it.
yeah.
They might
Yeah,
have done it
I
at
mean-
the end of their shift.
Yeah.
Though
And it's
for
so
sure
hard.
they did at the end of the shift, yeah.
My mom's in a rehab facility now for a stage 4 bed sore from a facility that was, we're paying over $10,000 a month, and she got it there. And so that would have been very valuable to have that there. And now the facility, it's great. I mean, because the bed sore, it's almost healed. It's been months now, but it's almost healed. But suddenly her charts disappeared in her room. Like 2 weeks ago, they're suddenly, and they were there, and they were all, her hydration and her turning were all there, and suddenly they're gone. And we keep asking them, where are the charts? Oh, I don't. It's like they don't know where the charts are. It's like, so these are things that you wouldn't even have to worry about, if with something like this. But I going back to like, they have to wear something. The caregiver has to wear something. What if they just say, yeah, no, I'm not doing that? How do you get around that?
So the organizations that we've worked for, it's become, you're going to wear it. Like if you're working here, you're going to wear it. Why do you not want to wear it? We don't track outside of a patient's room. We don't track outside. We don't track what you're doing in a break room. So if you're in the room and you're doing everything you're supposed to be doing, why are you opposed to doing it? It's a less invasive than having a camera there, right? We also tell you if the tag's been taken off. So why have you taken it off? Like, we give a lot of room in our software for explanations, like reasonable explanations, and then let managers decide how that appears. Because there is times mom refuses to shower, mom refuses to go to the bathroom, right? Those things happen. And we do leave room for that because it is part of the job and part of a normal situation. But when we went back in after explaining to the caregivers what we were monitoring, we were very upfront. And the nursing home we were working with was great and actually offered a shift bonus, which he was like, I'm offering a shift bonus for them to do their jobs, but let's see what happens. So we put it back on them. They knew what they were monitoring. Guess what? 97% compliance.
Wow.
And the times that didn't
Go
happen,
figure.
they had a really good answer to why
Reason,
it
yeah.
didn't happen, right? It was usually super understaffed night shifts that they couldn't get to it. But compliance was there. And the 3 patients in particular that we were really focusing on never had a return to hospital. These things matter more than I think the caregivers even realize, and they don't realize how much a part of care success and how that family member is our loved one is going to live, that they really are.
Quality,
Yep.
quality
Yeah.
living.
And would this be? Go ahead. Oh no, I just wanted to say one more just on this. Would this be something that, if God forbid there had to be a court case or something or a legal, would this be submissible as far as evidence, so to speak?
It's evidence that if they weren't there, if they didn't do what they were supposed to do. So yeah, it would lend itself to he said, she said with caregivers who are not doing things. Mm-hmm. That was actually why this product was created. My grandma had aides at night at home, and all we really were asking of them is just sleep in the room with her. If she gets up during the night, please just help her to the bathroom. We put a really comfortable chair in there. That was all they had to do because we were handling a lot of the daytime stuff. And my grandma, we would come in the morning, and my grandma would be like, she wasn't in my room again. So what do, right? You go and you say, hey, were you in the room? She said you weren't. And the answers are, she's confused. She doesn't understand, right? And I was like, okay, maybe nighttime. She's on medication. And this went on. And then one night, she yelled. She got up. She yelled for her aide, who was sleeping in the bedroom down the hallway. And she broke her femur. Mm-hmm. And that was really where this came out of, was I need to be able to see where everybody is, because if I would have been able to see that that person wasn't there during the night, I could have made a phone call and been like, hey, get in her room and don't take your tag off, right? Let's stay there. Let me see you're there. Because my mm-hmm. grandma's life was cut short because of that.
Of course.
Mm-hmm.
Of course. Do the facilities that engage with this, do they pay for it, or how does that work?
They're passing it along. You know, there's community fees, and there's a fee here and a fee there. Those communities are good at fees, right?
Yes.
So I think a lot of them are getting hidden in the fees. Some facilities are actually saying, if you want this, you pay for this, and then we'll take it from there. And a lot of facilities
how does that work yeah. Oh, I'm sorry. I was just going to say, how does that work as an individual? I'm like, okay, my mom's going into a facility, and I want her to have this service. Mm-hmm. But now everyone, the entire staff, in theory, would have to be wearing these. Has to be arranged with. So if I'm the only person who's requested this, the facility says, yes, we're going to do it. So do I pay for all that, or are you monitoring every patient there all of a sudden? How does that work?
So it is patient by patient. The facilities that have not decided to take it on facility-wise and cover those costs, they're the ones who are saying, we're not going to let you monitor our caregivers, at least for now. We've had pushback on the caregiver piece. We've been very open. People have been very open to the monitor your loved ones, under the assumption of, if we let you take a look at how mom's doing, you're not going to call us. That's been or an extra selling point, like, why pick facility A over facility B? Well, here I know at least there's some kind of oversight that I have that's not just a phone call to management who's going to tell me whatever I want to hear, right?
Mm-hmm. Have you gone to CMS? Have you gone to CMS and talked to CMS about, because it would, the Centers for Medicare and Medicaid, seems like it would lighten their load of oversight to make it mandatory to have this.
No, I haven't yet. Becoming a paid entity is a big, long process. So as of right now, we just haven't gone down that path, but it's definitely something that we could look for in the future, because
this is something that we need to advocate for. It just seems like a no-brainer. Yeah. It seems like a no-brainer, because that way there's no discrepancy on charting. There's no, you know what I mean? Like, unless somebody learns how to hack your technology, right now, that's the best, to me, it seems like the best way to do it. The best, it just seems like the best kind of,
but it's also a wonderful marketing tool for a facility. I would think they say all of our, everyone is monitored. You're safe here. Your loved one is safe here
monitored,
because our staff is monitored. It seems like it'd be an amazing marketing tool for a facility.
Well, it would be, except that facility is now under the microscope.
Well, if they're a good facility, they would want that.
We've tried to talk to them. Yeah. Sorry. Do you want? So we built it in a way that when they go to acknowledge the task, right? We actually say to them, hey, guess what? This wasn't met because of these reasons, right? So we give them the opportunity to self-correct before it actually is something that is marked that they didn't do it. We really give the opportunities here to more incentivize them to do it. So when they go to chart and they're like, and it's like, nope, you didn't do it, go back and try again. We give them the opportunity to say why, right? Why it didn't register, like, no, she refused, or we got her in the bathroom and we weren't able to fulfill the task. But on the other hand, it's usually because you didn't do it or you rushed, and it allows you to fix what you're doing. It really just pushes them to do the right thing.
But now you also put it on the patient too, right? Is it both or one or the other, or is it always both?
So it is both. So it looks just like a Fitbit. I didn't bring one to show you. So it looks just like a Fitbit for the resident or for your loved ones. It does all the vitals and we do all that kind of stuff. It has a help request button. It does a lot of really neat things. And then the caregiver wears a tag as well. So we're able to tell you if you took them off, if we actually alert to it, like this has been removed. So there's a lot of nice features that give way to even patients with dementia who might take things off. But we've found that it's so lightweight that as soon as it's on, most people don't even remember they have it on. And it's got a 10-day battery life.
Oh, wow. Is it waterproof? Can they get bathed in it? Okay, great. So it also feels like that this technology really facilitates, data for research, right? So it kind of, it eliminates surveyors going in and looking at charts that have been judged to do, right? So it feels like this would help CMS do their job better and more efficiently without, having to pay for surveyors to go out who are often, not doing their job. Let's say.
And we're adding an AI piece that makes it even more lovely because it literally just tells you what happened all day. It gives you a synopsis, so we give you a lot of raw data between location, how close you are to the person, all the tasks, but we also give you a really nice, lovely synopsis that says, here's what happened today. Here's what was different today. Here, and you can actually look caregiver to caregiver as well. So if Mary has a tendency to never be able to give a shower, and Jane can always give a shower, we can even kind of understand why that's happening. And maybe Mary and Mom don't get along, right? That happens. And that is a reasonable thing to happen, right? Sometimes you just don't like the person who's helping you and you're going to be obstinate. But we kind of inform that. And so changes can be made. And you can send a caregiver who's going to do a better job and be more efficient.
I love it. I think we should include that in our advocacy, because when people say, "Well, how can we change this under this model, the current model?" That just makes so much sense to me. That's one easy. That's an easy lift. That's low hanging fruit right there.
Yeah. And even if these were in 10% of the facilities, that would be a lot of people.
No, it needs to be 100%.
No, I'm just saying. I'm just saying.
I know, but I'm saying we advocate for CMS to just approve it as a mandatory, data collector. It just has to be. It doesn't make it doesn't. It's counterintuitive if you don't have something that's available.
I'm sure the nursing lobby would say no.
I know. I understand that. That's why we're roaring.
I'm going to roar with you. So if you need me to roar, I'm
need
there
you to
with
roar.
You. Oh, yes.
We do.
We need some roar. We need some roar.
I would love it.
Yes. No, we're going to roar. We have to roar because we get asked this well, what's your solution? You're it's there's a lot of solutions.
There's not one solution. There's not one solution. This could be a big part of one.
I mean, money, when you've got greedy corporations and who have no idea what they don't really know what long-term care is. They don't care. They're doing la 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 and I remember going to a Christmas party from it was a reunion with this big media company that I used to work for, and the president, the CEO was there, and he was he was acknowledging our documentary and congratulations, because it's in the entertainment industry, and we're talking about it, and he's like spewing his uneducated opinion about long-term care. Listen, he's telling one of my ex colleagues, like, don't worry about when your mom gets there. There's these places, they're great. I put my mom in one. They know how to deal with them. This is not,
it's really not an issue.
It's not an issue. And I'm like, well, what are you talking about? Like, but that's people that live in money land. Like, that's where their heads are at. And that's a whole different kind of humanity that
but
doesn't
even in
understand.
Moneyland, even in Moneyland, you can't rely on the fact that they're actually
No, I
going
know.
to be taken
I'm
care
saying,
of.
like, they live in a delusion because they want to.
Right.
Because it's better for them not to have to worry about it or think about it, because clearly the problem exists.
Oh, for sure.
And maybe
board.
he's an investor. Maybe he owns, who knows, because he was like talking like, it was everything wrong. Everything he was saying was actually the opposite of what the truth is. So anyway, but we need to like provide answers for the CMS, so that there's no way that they can say, well, we can't afford that. Yeah, you can't afford not to do it.
Yeah, and it's going to come to that, I think. I mean, the amount of tragedies that happen in these facilities is costing everybody money. I mean, besides all of the human elements of that it's just unkind and it's not how humans should be treated, and families in distress, it's costing money to have poor care. And you would think that, well, that's not how I know we're all looking at it, but at least you would think that would incentivize them to kind of take a look and want to make the change.
We say that too in the documentary. Like Rick Moncastle says, if you're not motivated by your humanity, be motivated by your wallet, because this money that is getting taken out of your paycheck week by week is being spent to buy, other people's vacation homes and private jets, and not where it's supposed to go. And when you need it, you won't have it, because that money won't be there for you. That money's going elsewhere. It's being you're going to get the minimum, and you'll be happy with it. That's it. Air quotes. But that
this is what you get. This is your only choice. So where do you stand?
This is your only choice. You're between a rock and a hard place. I mean, we all know those conversations where I'm so sorry you're not happy here. You can take your mom home.
You're just stressed. Stressed.
You don't understand. And it truly is the lack of care. Unfortunately, I will tell you, I've seen home care is faster to adopt this and watch their aides, but. Which is great. I do think if you're paying for that level of care, right, that should be part of it. But it's too expensive. And in a lot of cases, it's just not safe to be at home. Like, we have to look at the safety aspect, and it should be a nice place where when we talk to our parents about assisted living or nursing homes, it's such dread, right? It's like, just whatever you do, don't put me there. I'd rather die than go there.
Always.
It shouldn't be that. If you talk about assisted living, especially those really high-end ones, it should be like, hey, Mom, you want to go to the country club and live in an apartment building with some really cool old ladies and have lunch with them? That's what we should be looking for. That should be the end goal, right? For everyone, for our parents to look forward to.
Yeah. But boy, when the acuity goes up, it changes really quickly, because that's the way my mom started that way. It was a beautiful place. It's still a beautiful
Brand
place.
new.
She doesn't live there anymore. And it was lovely, and she didn't need much care. But the second that care level starts having to go up, and even though they raise your monthly because you're now on another care level, it just starts disintegrating. It starts falling apart. And when she ends up in memory care, forget about it. It's just completely falls apart. And I'm sure this is something in memory care that would be absolutely invaluable.
Yeah, that's
I want to ask. Yeah. Oh, go on.
That's kind of where I spent most of my time as a nursing assistant, and a lot of this was built out of what I saw missing there. Those, they can't advocate for themselves. They can't verify aides are very quick to say they're just not, they're confused, right? So it is really where my thought was of here's a fit, because we do need to advocate for these people.
100%.
And we didn't know. Yeah, we didn't know when my mom was telling us something. We had no idea if what she was telling us was real or not. We had no clue. you know.
Right.
And so
at least your mom could talk, because then many people
that
with,
time, yeah.
advanced Alzheimer's and dementia can't communicate.
Yeah.
So, you've got that. And, as I said in my documentary, they had the chaplain from the hospice telling me that my mom had holes in her brain and don't worry about it. She has no idea what's going on. It's like, oh my gosh. People are so uneducated about dementia and Alzheimer's, from every area of the industry, including doctors, including many of our frontline providers, don't really understand how, what really goes on with someone who has dementia and Alzheimer's. So, so memory care, we always say, is just it's just marketing, because there's not real memory care going on. I want to switch over to your other service that you do, which is to prepare people for, this time of your life and really get all those when you're, before you're ready to move your loved one into facility care. So financially and all those things, because it's so confusing. And that is such an important thing to that information is vital, and I didn't know anything about it. And even now, like Don and his family, his siblings, going through that, as it always happens when someone needs more care, it happens quickly. It doesn't gradually creep up. It's like it happens. They're
like
this
really
way, and now they're
fast.
this way, and they need it. And and everyone's going, yeah, but you're medicated. She's not going to qualify for Medicaid. Wait, she had Medicaid, but what about that? Do we have to spend all her money? Nobody understands it. Even the lawyer, the trust lawyer, didn't understand it.
And it's different state to state too. Every state has a different rule. So you can't just say, oh, this is the way it is. And it changes. It just changed January 1st. All the rules changed as we were trying to get my mother Medicaid. And so we knew that in case we had to put her in a Medicaid facility, we could. Right now, thank God she still has some funds, but those don't last forever. And so suddenly we were like, the whole landscape changed as of January 1st in California. It's different in everyone. So, yeah, your services, tell us a little about those.
Yeah, tell us about that, because this is super, super important.
Yeah, I think my main goal with this site right now is really to educate everybody about we all need to plan for long-term care, right? So we have to plan for our parents, but we need to start thinking about ourselves, because the system, if we stay on the path we are, is going to just continue to break down and get even more expensive. And we're all in for a real shock of what that's going to look like. And there's not enough education about who pays for it. And the answer to who pays for it is we do, out of our pockets.
Right.
Your savings is what is paying for your care. So don't stick your head in the sand, because there's a 70% chance, and that chance is increasing as comorbidities and health change, that you're going to need care. So we help you really understand what your financial situation is today and where you're headed. And understanding with that, with what your comorbidities are, what your family history, what are you really looking at for care? What is your actual chances of needing care, and what does that trajectory look like given your personal health history? And so we really come out clearly and say, like, given what you have, you're most likely looking at $600,000 of care. Given your financial situation, here's where your deficit's going to be. So if you're early enough, which is why my main goal will be to teach everybody that planning early is key, right? There are financial tools that are reasonable to help you plan for this moment in your life, but there are some really nice ways to plan for Medicaid ahead of time, right? And there's funeral trusts and Medicaid, different kinds of things that you can do that can be really thought out, which also can end you up in Medicaid sooner, meaning you get to keep more of your assets in different ways and be more comfortable, because what your daily allowance is for Medicaid, right, is very low. It doesn't lend itself to even buying a grandchild a birthday gift anymore. So our hope is that we can really help you find this beautiful, safe landing. We are partnering with some really great experts in Medicaid who have national coverage who are going to be available to also help. We are on the site. There's an ability to actually take these tools and kind of plug them in to your financial situation and see what they do without having to talk to anyone. Like, what looks best for me? Or is Medicaid the best option? And these are things that really hopefully people will start thinking about sooner, because given longevity, we're going to spend a lot more time being old and a lot more time needing care. So we should all plan so it can be a better experience for either our parents or ourselves and our children. It will be easier for our children if we plan now so they don't have to be going through what our
They
generation
don't have to
is going
inherit
through
this
now.
problem. Yeah, they're going to inherit the problem.
Yep.
They just will, like we've inherited it, right?
Yep.
What does that service look like in terms of the customer? How does that, is that like a private paid service?
Nope, it's free for users, free for families. That was really important to me, was that there's a lot of hands and pockets in care and in long-term care. I feel like everyone...
Amen.
Right?
Amen.
Everyone has their hand out. And I wanted to give them something that gave them the ability to plan, or at least get an idea of what they need without a hand in their pocket. Because there will be somebody's hand following mine, right?
Yeah.
So if it turns out you need more Medicaid planning, I can't do that for you, but I'm going to tell you on the site, I'm going to match you with someone who I think is qualified, that I know is not going to just throw you into Medicaid financially and then realize that you don't actually qualify given your ADLs. I'm going to give you people that I trust that are going to help you, and they may cost something, so I don't want to. And
Can you say what ADL is, so in case somebody doesn't know?
activities of daily living. So toileting, showering, dressing, those are things that Medicaid actually looks at to qualify you, and each state is different. I obviously don't know every rule in every state, but if you don't meet those marks in that state and you plan for Medicaid financially and you don't meet the mark, then you're still not getting it. And now you spent all this money to get somewhere that doesn't work for you today.
Right.
So I really kind of am hoping that we're giving you, I know we're giving the best recommendations. And so
Such a
I'm
good
proud of
tool,
that.
so important. Yeah, no, you should be proud of it,
Yeah.
because I think everybody needs it. One of the things that we're trying to do is to take the stigma away as much as possible of aging, and the fear that is so common, obviously, about getting older, and so that keeps people from doing what they should do. I'm guilty of it. I was guilty of it, and I still am a bit guilty of it. And I'm trying to practice what I preach, which is, we need to really take care of business. You have to.
And if we don't want to do it for ourselves because I'm not going to be old, it's not going to be me, I'm going to be the one
Right.
who is running at 100, right? Or put a pillow
Me
over my
too.
head, right? Yeah, right. Like those are things you
Who
hear.
isn't, right?
And I hope I'm doing that. But
Yeah.
in the more probable case that I'm not, I think we just have to really look at our children and say, what do we want from them? Their lives are not getting easier in this
Right.
world. And do we
Right.
want to be something else that they have to struggle with?
Exactly. And, like I remember my manager when he first watched the documentary, and he was like horrified. He goes, because he's a bachelor and doesn't have any children, he's in his 60s. He's like, I'm freaking out. He goes, what am I going to do? And he's like freaking, because I called my sister in Chicago. I'm like, I'm devastated. Like, this is my future. And I said, it is. I mean,
And a
it
lot of
just
people think
is.
it's too late. Oh, it's too late. I'm already at this age. I can't start planning. I mean, but it's no. Or like, I know I don't have enough money and I don't even want to think about it. So what do I do? Or I'm just going to ignore it. and hope it goes away.
Well, it's not going to go away.
No,
so,
it's not going to go away.
It's not going to go away because my mom and I tried that because she told me we're not getting old or we're not going to get there. And she told me, she said, no, that's for other people. That's not for us. And so, but it doesn't, It
doesn't work that way.
It happens, and it happens fast too. So we really need to do it. What a great service that you're providing, Lindsay. Both of them are really smart and really, really well thought out and really necessary. And I'm here to roar for that because I think what you're doing is really great. I really do. And I love.
And it's not only for older. Yeah, it's not only for older too. Yeah. It's for somebody who, the younger people can have this issue too. So.
Yeah. Well, Lindsay and I were both talking about when we won't get into all the details, but we both had similar situations in a different way. It was a different cause, but we both were incapacitated for quite a while when with our young babies at the same time. Pretty, kind of similar manifestation, but yet from a different source, right? But we both had to engage with caregivers to even put our socks on. We couldn't hold our babies. It was just devastating, and we were both very young. I imagine I was in my 20s, and I was like, devastated. And so we know it from that point of view too, and that you bring that experience with you. As a younger person, thank God you've recovered, but what if you didn't?
I thought about that all the time. So, because I had caregivers, it was almost 2 years. It felt like a lifetime.
It feels like a lifetime, right? It does.
And I got really lucky because I found a doctor who was able to really help. But I spent so much time thinking, what am I going to do? How am I going to help her? My daughter, I'm like, how am I going to be a mom to her? How am I going to have another relationship? Because I ended up going through divorce because being a caregiver for someone who was in his 30s was not something he anticipated. And I was probably difficult too. So I can only imagine because I was
depressing.
Depressing.
Nobody wants to feel sick and be incapacitated. It's not fun. It's not life.
And think of the length of time that would be if you start younger. Think how long that, if you're in this long-term care for the rest of your life, my God. It's
we've got to do better. We have to do better.
Absolutely. Because there are people who I know even had the injury and illness I did who are struggling. I was in a Facebook group and so have kind of kept in touch with them. And these people are still struggling. And this is 15 years later.
Yeah.
And I'm so thankful that I was able to find my way back to health.
Thank God. Yeah.
Right. But it would have been, I think about not only the physical strain of what that would have looked like and changed my life, but the financial piece of that. I don't know. I would not have been able to cover full-time caregivers for myself for now the rest of my life because also what happens, you're no longer working and you're there was whole pause of everything else.
It's a whole ripple effect. Yeah. And I remember in the hospital, because I was in the hospital for I was in the hospital for 10 days, because I had surgery. And I remember thinking, this is not the life I want. If I don't get better, I don't want to live anymore. Because I just felt like it was just the most horrible situation. And I couldn't imagine being in that pain and being incapacitated for so long, and I look back on it and I remember having to lay in a certain position. It was the only position that kind of relieved some of the pain. And we both lost a lot of weight because we couldn't eat, right? I was right. So I was skinny, bones, skin and bones. And I remember getting red sores on the side of my hip because I was getting bed sores, but I didn't know what they were.
Yeah.
Didn't even know.
My left hips. I had them on my left hip because the right was really bad. So I would always sit off to the side. The boppies or whatever that they gave you for your baby to hold. that was the only thing that could get me to sit. And so I would like sit on it and cock it up. And, but yeah, I was getting
Girl, we
scores
had the
on my-
same thing with the same challenges. It's awful, and and then you just add on the depression on top of it, right? I think having that perspective gives you so much empathy. It gives you so much empathy and gratefulness for being, because I go to the gym, I dance hip hop, everyone knows me. I post my hip hop all the time. And to this day, and it's been so long since I was at that stage, I'm so grateful to have my body that I can do this stuff, that I can lift weights and I can jump and I can do all this stuff, because I thought I didn't know if I ever would.
Yeah. And I think as caregivers, my biggest suggestion is understand that this is the perspective that your loved one is coming from. Because in most cases, when they're 85 and they're having the same sort of depression and grief and all of these really overwhelming emotions, whereas like Susie, you and I were like, okay, if I get better, I have a life ahead of me. The truth of the matter is that most of these older folks, this is the rest of their life.
Yeah.
There's no coming back from it, and they're very aware of that. And
Right.
I think being really respectful of the fact that these folks don't want your help, right? They need it, but they're also fighting with that kind of
Dignity.
same emotion and
Dignity.
and all of these things. So as professionals in the industry, we really need to take that into account of all of the feelings that they're having. So sometimes if behaviors are not feeling if you're not feeling as respected, just remember how they're feeling.
Yeah. Absolutely.
And the finality is just, it's there, and it's you can't talk them out of that. You can try to make them feel better in the moment, but my God, if you put that on yourself and think of right now, if I knew that right now, how would I feel? What would my mood be? How would I be treating other people around me? We like to think we would be our best.
I did think about that a lot.
But yeah,
I thought about that with my mom all the time. I tried to, that's why, that was my only tool I had, was my empathy. That was all I had, because I didn't know anything about the industry, but all I could do is go in and sing,
And that, I think, matters more when it comes to like a home health aide or that. Like the biggest skill they need isn't a skill. It's empathy and compassion.
Yeah.
That matters more than how well you can actually shower somebody, because you can all learn all of those things. But coming
Yes.
into it with the perspective of really wanting to care for somebody goes so far. You can change the rest of somebody's life. Truly.
yes.
And yours. Because when you change someone else's life, even if it's for the day, I cannot tell you, I can tell you, Lindsay, but the rewards are, they're priceless. So you have that, and those are the jewels you get, are the the gratitude is incredible, and you can't feel better. There's nothing else that make you feel as good as alleviating somebody's stress or pain.
Even for a
Is-
moment, even like
Yeah.
if we can get my mom to smile or chuckle or something, just for that moment,
It's the best.
because she doesn't the rest of the time. It's the reward. It is such a reward, and just know for that just second she feels a little better.
I want to
has a
say
little
something.
joy.
I just watched Jay Leno's interview with Maria Shriver. Did you see it?
I did.
I love him. I have such mad respect for him now, because he gets it, and his joy of leaning into his wife's journey, and the fact that he's so all in, and his only thing is to be with her and make her happy, and see what food makes her happy. What can he make her laugh? Can he make all those things, because he's in it. He's in it, and he gets it. And what a mensch, and what a good person he is, and what a smart person he is. I just love it. I'm glad that he's speaking out because my manager knew him and he was trying to reach out because he's very private, by the way. And that's why it's taken him this long to talk about it because I wanted him to talk about it in our documentary, but he was very private. I'm so happy that he's talking out because it's going to really put it into a great framework for other people because that is his joy right now, is this relationship. And, he said for better, for worse. That's it. That's all you need to know. And that's, you don't need a license for that. You just need a heart.
Yeah, it is. It's a really beautiful story. And I think if we could all approach kind of caregiving from the same point, but again, broken system makes it so most caregivers are stressed and overwhelmed. But if we can take a step back and take a breather, hopefully everyone can find that because you really are doing such a good thing at caring for somebody when they need it most.
Yeah, it is. If you're religious, it's God's work. If you're not, it's your heart work, and you need to, and that's, you're going to get so much out of it. So even if, anyway, it's all about love, right, Don?
It is. It's all about love. It's a big love fest. You know why? And that's because love is powerful. Love is contagious, and love conquers
So true.
Alz. We thank
Love
everybody
conquers
for
Alz, you guys.
It does. It
really does.
Thank everyone
Look at
for
Lindsay.
watching.
Look at her. You're
I know.
incredible,
She's-
Lindsay. Thank you for
she's
joining
conquering
us.
it alls and everything. So
Yeah, I love it. I
Thank
love
God
it.
for
I love what
Lindsay.
you're doing.
Thank you. Thank you so much.
Thank you guys
Absolutely.
for listening and keep sharing, please. We're gonna be back now with a force. We're gonna blow your minds with all of our great guests and great information and a little bit of push. So we're gonna be pushing you to so you have a better life.
and roaring
as you grow
at
older.
the same time. Yes, we're going to
And
roar,
what, Don?
roar at the we're going to roar all
Oh,
at
and
the same
roar.
time.
Yeah, roar. Everybody roar. Become warriors and roar because we all need to while we can roar, right?
Absolutely.
All right. Take care. Bye, everybody.
Thanks, everybody. Bye-bye.